Hi, my name is Yash, and I'll be talking about a novel treatment for glioblastoma multiforme, investigating autophagy-inducing substitutes for the Beclin-1 gene. So, a little bit about me. Well, I'm a rising 10th grader at American Heritage School Broward in South Florida. I'm involved in my school's chapters of Mu Alpha Theta, Science Olympiad, Spanish National Honor Society, and Sigma Xi. I'm also a former co-president of the National Junior Honor Society. I participate in summer programs like MIT Future Makers and Columbia IYRC Medicine and Research Program. I'm very passionate about finding holistic treatments for a range of oxidative stress-related disorders like glioblastoma multiforme, systemic lupus erythematosus, fetal alcohol spectrum disorder, and addiction. So to begin, globally, approximately 300,000 cases of glioblastoma are diagnosed per year, and approximately 200,000 glioblastoma patients pass away annually. In fact, glioblastoma only has a 35% survival rate by 1 year post-diagnosis and 4.7% survival rate by 5 years. In comparison to other cancers, glioblastoma is very fatal, as you can see in the graphic to the right. This just goes to say that something needs to be done about glioblastoma multiforme, or GBM. But what exactly are glioblastomas? Well, to answer this question, we have to start with astrocytomas, which are a type of brain tumor. And astrocytomas start in cells called astrocytes, which support and connect nerve cells in the brain and spinal cord. There are four grades of astrocytoma. Grade 1, or non-infiltrating, are slow-growing tumors that typically don't expand into surrounding tissue. Grade 2, or low grade, are tumors that usually develop slowly but can expand into surrounding tissue and grow more quickly over time. Grade 3, or anaplastic, are tumors that grow faster than those with grade 2. And grade 4, or glioblastomas, are the fastest growing and most aggressive type of all nerve-persistent tumors. So, glioblastoma multiforme. As I said earlier, they are grade 4 astrocytoma, which means they're fast-growing and aggressive. They occur most often in the cerebral hemispheres, especially in the frontal and temporal lobes of the brain. If left untreated, it can result in death in 6 months or less, which means it's imperative to seek expert care immediately. And by the time it's diagnosed, it is already likely advanced. So the symptoms of glioblastoma depend on where in the brain the tumor is located. However, some non-specific symptoms include headaches, seizures, nausea, vomiting, and drowsiness. Some specific symptoms include changes in personality, which would be in the frontal lobe, memory loss and speech difficulty, which would be in the temporal lobe, and changes in vision, which would be in the occipital lobe. Some existing treatments do exist, however, they're not very effective, like chemotherapy, irradiation, and surgical resection. With glioblastoma being the most commonly occurring primary malignant brain tumor, it is imperative that we find a cost-effective treatment for it, and soon. Looking at this chart, we can see that the GBM market is predicted to be worth $4.7 billion in 2033, meaning that not only are current treatments not working, but they are very, very expensive. I propose that we can find an effective treatment using the Beclin-1 gene. Beclin-1 plays a role in the initiation and regulation of autophagy, and increased levels of autophagy have been shown to inhibit GBM cell proliferation by suppressing the WNT beta-catenin signaling pathway. Beclin-1 also is a part of the PI3K complex, which aids in the formation of autophagosomes and helps cancer cells proliferate and grow, using autophagy to resist treatment. Beclin-1 proteins also play a role in autophagy and help its tumor suppression properties. However, the problem starts when the Beclin-1 gene has irregular expression, which can lead to many cancers and even neurodegenerative diseases through the PI3K pathway. Basically, this means that reduced expression or dysfunction of Beclin-1 has been associated with the progression and poor prognosis of glioblastoma. This means that the purpose of my project is to find a substance that can increase autophagy as a substitute for Beclin-1. So I will be using three inducers in my experiment. My first will be rapamycin. I will be using this because mTOR inhibitors like rapamycin have been shown to induce autophagy and have potential anti-tumor effects. My second inducer will be telaglenastat, a small molecule inhibitor. I'll be using it because small molecule inhibitors can target metabolic pathways and can selectively induce autophagy in tumor cells. For instance, telaglenastat inhibits glutaminase, leading to metabolic stress and autophagy induction. My third inducer will be trehalose because it has been shown to induce autophagy by stabilizing cellular proteins and preventing protein aggregation. So for my experimental design, my independent variable will be U87 glioblastoma cells treated with autophagy-inducing substitutes for the Beclin-1 gene, which will be my rapamycin, telaglenastat, and trehalose. My dependent variable, which is what I'll be measuring, will be cell viability, metabolic activity, LC32 levels, and LDH levels. My control will be the U87 glioblastoma cells that are left untreated. So my model organism, like I said before, will be U87 glioblastoma cells, and I'm very fortunate to be receiving these cells from a university professor. So in order to test the efficacy of my treatments, I will be performing 3 assays. The first will be the MTT assay because it reflects changes in mitochondrial function and overall cell metabolism, and it is also a reliable method to quantify viable cells. And at the bottom, you can see the source that I got the idea for this assay from. For my second assay, I will also be performing the cellular autophagy ELISA, and it'll be performed because it quantifies LC32, and LC32 levels are increased when there is induction of autophagy. My final assay will be the LDH cytotoxicity assay because it measures the release of LDH, or lactate dehydrogenase, and elevated levels of LDH are associated with poor prognosis in various cancers like GBM. High LDH levels may indicate increased tumor aggressiveness, resistance to therapy, and poorer patient outcomes. In conclusion, targeting Beclin-1 and the PI3K complex is very relevant because it can treat glioblastoma as well as other kinds of cancer, as well as neurodegenerative disorders, as there have been studies that show that reduced expression of Beclin-1 and autophagy dysfunction, as well as issues in the PI3K complex in Alzheimer's disease, Parkinson's disease, and ALS. In fact, rapamycin has been used as a treatment for Alzheimer's in the past. Thank you. These are my references, and these are my acknowledgements. A huge thank you to Dr. Hopkins, Dr. Shah, and Dr. Sood from American Heritage School Broward for helping me form my project and directing me to all the relevant research. Thank you to Dr. Ray from Johns Hopkins School of Medicine for generously donating some U87 glioblastoma cells for me to use in my project. And thank you to Johns Hopkins for hosting GHLC and giving me and my peers the opportunity to learn about global health issues and present our own work. Thank you, the audience, so much for listening. If you have any questions, please email me or reach me at my LinkedIn.